If you sat next to this group at lunch, you wouldn't think anything was wrong with any one of them, let alone all of them. Only if you happen to watch closely enough, long enough, would you notice one unusual thing. Sooner or later, one by one, each member of the group will give himself or herself an injection.
You'd walk past me in the street and you'd have a hard time just saying, oh, that poor lady, she's going to be dead by the end of the year.
All the people at this table, including this Georgia woman, have been told they are dying. So why are they in such a good mood? Simple. They don't believe it. Not anymore. Not since coming here. Welcome to Freeport on Grand Bahama Island, where the unlikely happens all the time. In the last 2 decades, more than 5,000 terminal cancer patients have traveled to Freeport to receive an unconventional treatment, not available in the United States, but allowed here by a more permissive government hungry for every American dollar. It would be simple to dismiss the purveyors of this serum as quacks preying on the very ill and very desperate. There's only one problem.
We have a lot of people who are surviving way past their expected date.
Life is slower in the Bahamas, and some hope death will slow down as well. For these people, Freeport is not merely a resort, it is the last resort.
Action News Prime Time with Channel 2 anchorman John Pruitt and special reports by Dr. Randy Martin and health reporter Diana Davis. Tonight, the last resort.
Welcome, I'm John Pruitt in Freeport. Legendary lawyer Clarence Darrow once said, "We all know we're going to die, it's just that nobody really believes it." Well, imagine your ability to deny mortality is suddenly a luxury you can no longer afford. Your doctor has handed you a death sentence. So where do you go if you want to appeal? She is one of thousands, perhaps millions of Americans playing the alternative medicine game, betting on this traditional remedy or that unproven treatment. But few gamblers play for stakes as high as this accountant from East Cobb County. We met Corey nearly 2 years ago, shortly after her 50th birthday. According to statistics and her first oncologist, she was already supposed to be dead.
It was a very rare type of cancer, always fatal.
She had sought a second opinion, then a third, and a fourth.
One literally said, well, all you can do is go home and wait to die. It was probably the only day in the 3 years that I totally caved in.
The prognosis when this divorced mother of 3 boys was completely unprepared to hear or accept.
I probably wouldn't see 1998.
But Corey celebrated the new year with friends and has continued to amaze the medical community ever since. To the oncologist who told her she would be dead by 1998, she recently mailed this photograph of herself, taken while undergoing an unorthodox treatment in the Bahamas.
And I'm hoping that that picture may be just a reminder to him, just a little, if nothing else, just a little, before I take away hope. There's somebody I said was going to die.
Take some deep breaths in and out. Hers fits in that miracle category. There's no question about that.
Dr. Richard Leff, the oncologist who now treats Corey Harth, says recent tests show her cancer has shrunk. But she's been trying so many offbeat treatments, he isn't sure which one, if any, is responsible.
And this is one of the problems. There is no patient, including Corey, who's doing one thing. They're doing everything because their goal is to get that edge.
Here we are approaching the year 2000. What's the prognosis now?
She so far exceeded the prognosis that anybody would have originally given her that it's a total guess.
Who gets the credit?
She does.
I am healthier today than I have been in years.
Her current fitness is especially ironic in light of how she felt before being diagnosed.
It was an exhaustion like I have never felt in my entire life. I mean, it was just all I could do to make it through the day.
For more than 2 years, Corey knew something was wrong.
I could not find out what I had.
Until finally, she was referred to Dr. Frank Ferrier, one of Atlanta's most respected thoracic surgeons. He didn't know what was wrong either, but he did know the only way to find out was to take a look.
And at that time, we were confronted with this huge mass of tissue that was surrounding her lung and her chest wall.
When you discovered that, what was your reaction?
And I was very unhappy. because I know the natural history of the disease, and I knew that she probably was not going to have as good a survival as she's had to date.
Dr. Ferrier proceeded to debulk or remove all of the visible tumor, but he knew Corey Harth's struggle was only beginning. Is this one of the toughest cancers to treat?
It is.
Do you know anyone who has survived mesothelioma?
I do not know anyone that has survived it.
How remarkable is Corey Harth's survival? We asked Channel 2 medical expert Dr. Randy Martin to give us an idea exactly what she's up against.
It's very rare, very deadly. Mesothelioma, cancer of the pleura, the thin membrane lining the chest cavity and surrounding the heart and lungs. Oncologist Dr. Michael Finucchi of Emory University says mesothelioma is also one of the few cancers linked to a specific cause.
Asbestos fibers, and that's associated with a malignant transformation.
Years ago, asbestos, which is a naturally occurring substance, was used for insulation in ships, buildings, and even homes, and a lot of people were unknowingly exposed to it. Mesothelioma occurs when these cells, which make up the lining within the chest cavity, ingest asbestos fibers and become cancerous. This is a very aggressive cancer which can spread extensively. And once that has occurred, conventional therapies have had little success.
It's unusual to see survival greater than 1 year.
And 5-year survival rates are very low, giving a dismal outlook. Early detection of this deadly cancer is uncommon because the symptoms it produces, shortness of breath, fatigue, or a dry, hacking cough, don't appear for 20, 30, or even 40 years.
Corey Harth has no idea how or when she was exposed to asbestos, and probably never will. She decided other answers are more important. When we return, her search leads her here to an exotic island in the Atlantic.